COVID-19 is still here. I think provincially, what we have seen with this most recent wave of COVID-19, whether you refer to it as wave 7, whether you refer to it as the third wave of Omicron, or just another COVID-19 wave, but this wave has not come back down to baseline levels as quickly as some of our previous waves. And certainly now with schools back in person, with post-secondary schools back in person, with greater interactions moving indoors across families and community members and friends and other activities at the community, we certainly expect to see an ongoing amount of COVID-19 activity and quite potentially increasing over the next couple of weeks, regardless of whether it's considered a new wave or not. I do anticipate that we will see these numbers increase over the next couple of weeks. The current variant that is continuing to circulate is the BA.5 subvariant of Omicron. At this point in time, there's not a new variant that's been identified locally that is becoming the more dominant one. So it's possible we'll just continue to see the BA.5 variant circulate until such a time that a new variant emerges and starts to become the dominant one. So where does this leave us for this fall? In previous seasons, we've talked about preparing for the fall largely in relation to influenza, and then had COVID-19 quite an approach quite separate to that. The provincial direction at this point in time is to really take more of an integrated all respiratory virus approach, understanding that there is not wider public health measures that will limit interactions between people, meaning that we are going to see other respiratory viruses circulate, and we have been seeing them for quite some time and are expecting, as happens in every other year prior to COVID, that as schools are back in session and more interactions happen indoors, that we see a surge in all respiratory viruses and we start the respiratory season. And finally, but certainly not least important, one of the most important is to stay up to date with vaccinations. And as we head into the fall season, really that's two-pronged. That's up to date with your COVID-19 vaccines and up to date with your influenza vaccines, as we know that the universal influenza immunization program is also rolling out this fall. So the province is starting to roll out the influenza vaccine. It's also a staged rollout approach with those people most vulnerable to severe illness receiving the vaccine first. So we start with those folks in long-term care homes that would be at highest risk of severe disease. And with the general population becoming eligible for influenza immunization as of November. Now, there's not a single shot that includes both COVID and influenza, but both shots can be given at the same time or during the same visit. So if for individuals that will become eligible or become recommended for their COVID vaccine as well as their influenza vaccine, we know that there are some potentially primary care partners that might be able to administer at the same time, or pharmacies as well.